I feel overwhelmed when I go to my center of excellence because I have to see so many people. How can I talk to them? For example, I was anxious and they wanted me to do cognitive testing, but I was so anxious already. So kind of how to manage that, especially if it would be skewing any kind of results with the testing.
So, first and foremost, we are there to help you and certainly don't want to make you uncomfortable. So please, talk with your care team and let them know if that is what you're feeling is very much too anxious to do a particular examination or cognitive test. Now, some individuals may be part of certain clinical trial studies, at which point, it is important to try to get those tests done. However, you can have control over when it is, you first show up and you're flustered from the traffic and you don't want to do a cognitive test right off the bat, then communicate that to your team too. There may be times when you take a break or have some time to relax a little bit in clinic and then try again, right? I'll pass this on to you.
I think URA communication is priority, and so when you come in, if there are any time restrictions, certainly please let us know at the very start and try to get you through as much of the day as possible. And you can tell us what you're doing, what your priorities. If you want to, if you need to prioritize social work and neurology, then let us know and we will make that happen for you. And we try to ask also. Just to make it so it's onus is not always on you to tell us, but we want to make sure that you know that we're happy to receive that information.
I think the only thing that I would add is that I would like everyone to understand that the services that we're offering are there to help you. You're not required to take us up on every single thing that we're offering. So if you show up to our clinic and we say we have all of these people who you can see, spiritual care and social work and psychiatry and neurology and genetic counseling, all of these people, you're allowed to say no thank you to some of them. Like that's not a priority today, and we'll figure out a way to get you the services and care that you need in another way.
My name is Marissa, by the way. And I'm a genetic counselor at the University of Colorado Southern Excellence for Adults.
I'm sorry I didn't introduce you guys.
Yeah, we both kind of skipped that, but thank you for doing. Next question, how do I know if my daughter is choking or aspirating? When should I perform the Heimlich? And kind of a follow-up to that, how do I stay calm in this situation?
Yes, that's an excellent question. So a couple of parts to that. First is aspiration. Aspiration pneumonia is a huge risk for people with HD. So we always recommend, even before there's a major problem, that people are evaluated by a speech language pathologist. And sometimes in clinic we say speech pathologist, and people think, okay, well, it's not my speech that's the problem. And they actually cover multiple things. So they do speech and swallow, and in some places they do cognitive testing also. So they do a range of things. So we try to implement that service instead of like a rehab service, if something has already happened, kind of like rehab or preventative. And so if you're at a clinic visit and your doc recommends speech therapy referral, it possibly is because of just some question or just an early assessment to try to prevent some of these complications for as long as possible. In terms of aspiration happens violently, so people might not know it. A good sign is if somebody eats and drinks, they cough a lot when they're eating or drinking. That's a sign that our brain is actually detecting some of the food or water slipping down the wrong pipe and then sends the signal to our body to cough. So we might not realize it, but our brain picks it up and is trying to help us by clearing our airways. So if there's a lot of coughing with eating or drinking, that's. In terms of doing the Heimlich, I do recommend that people get some first aid or do a first aid class for their loved ones in case there is an issue with choking. And certainly if somebody is eating something and then they look like they're trying to cough, but there's no sound, that is definitely There's a universal sign for choking, which is hand around the neck, kind of that motion, but it's hard for everybody to express that. So I think partners and caretakers should always kind of look out. I think that assessment of this pathology is really important because it'll give you a better idea of high risk times and foods and try to avoid it as much as
Well, that was fabulous. I don't think I have that much more to add. You know, caretakers are there day in, day out, almost 24/7 with their loved ones. And so they will have a better understanding of what difficulties someone may have with swallowing. And if, you know, someone may often clear their throat or kind of cough a little bit after they're drinking, and that's sort of normal. Then a dramatic change to kind of frank choking or something that's very different should be able to walk up this maybe an emergency.
I just want to add, because I think there was also a question about the emotional component of how do I keep myself calm.
Yes.
So one comment I would make about that is I think that whole idea of getting yourself trained and not just informed, but also trained is key, but also sometimes the best thing we can do is try to practice and rehearse in our mind. So if you've informed and you've been trained, for instance, on the hand maneuver, occasionally run through that in your head and imagine yourself performing it. Because the more you do that, the more in the moment you're gonna find yourself, I think, settling into doing what you need to do immediately and keeping yourself calm. So that would be the component of the emotional well-being.
If we have a neurologist that is familiar with HD, is there value in also seeking care or assessment at a center of excellence?
So we do for that question. So with a center of excellence, we get access to multidisciplinary care. So it's always good to have a local neurologist, especially one that may be comfortable treating Huntington's disease. But having a whole approach, having physical therapy, occupational therapy, speech therapy, genetic counselor, psychology, a social worker, maybe a spiritual leader or other services that may be available may be unique, and that you may not have access to that in your local community. And those other therapists, psychologists are well versed in Huntington's disease, whereas we may not be able to find as experienced providers in the local community. So I think it would be worthwhile. And often the centers of excellence, at minimum, want to see somebody on an annual basis. So it's not like your local neurologist where they want to follow you every 2 months. So it's much less burdensome.
I would agree with that. We have someone here who have a local neurologist that they enjoy working with and they trust, and so it's important to maintain that relationship and then checking with us every once in a while, perhaps every year or whatever works for their schedule. And that works very well. And if they're local neurologist questions, they can always reach out to us.
So, I know the question was about neurologists, but in terms of psychiatric services, I know many people who follow with a primary psychiatric provider and for things like, that are more, for things that are more common in the general population, like in everyone, not just in HD, like depression and anxiety, a general psychiatrist is usually very comfortable treating that. For more specialized things, so the things that I wind up focusing a lot on, at our center are perseveration, which is kind of obsessive or repetitive thoughts and behaviors, and irritability, kind of mood mobility, like your mood goes up and down throughout the course of a day or from day to day. That's something that we would most often want to see a psychiatrist who has a lot of experience treating people who have Huntington's. And then you may be able to kind of go back to a psychiatrist in your community who's more convenient. But I would recommend that folks see a psychiatrist, at least for our consultations. In cases that, where the symptoms are kind of less common and more specific to HD.
Yeah. So it might be difficult. We're very lucky to have Dr. Rao and other psychiatrists who work with HD centers. It might be very difficult to find in the community a psychiatrist that's very familiar with HD, but there are psychiatrists that are familiar with other neurological conditions like Parkinson's or other things. And so when people ask us, we typically say that in the community, the closest someone gets to having a HD specific psychiatrist is having someone who's very comfortable with neurological care.
Correct. So also it provides a resource and a sounding board for your local neurologist psychiatrist to be a part of the Center of Excellence. So if they have a question, they would have someone to reach out to who knows you and can provide, personalized recommendations.
Oh, I have one. You always have social work resources at your centers of excellence. And we're there not only to support you, but to also help with the practical planning and discussions of what needs to be in place and what you should be thinking about beyond just getting the medical care. So things like advanced directives, referrals to disability resources. How do I know when it's time to do such and such, and how do I access this resource? So that's another piece that's available to you if you connect with the Center of Excellence.
Thank you. I adopted my son who, from someone who has, HD. Do you recommend a child seeing a neurologist to watch, for the possibility of a child who is at risk of having HD, getting HD? Are there certain signs when kids are young at all that shows as a possibility of having HD? So I think, they're very curious about watching their adult child, but also knowing this person with HD and seeing where they're at in their stage and trying to figure out when it's best to have them see.
That is a tough question. So, in the end, I think it comes down to a personal choice and approach that parents want to take. We don't want to scrutinize and put a child under a microscope if they're not having symptoms or problems, because that can then cause anxiety and problems with the parenting dynamic. So, I think having a good pediatrician is very important. And if they start to raise red flags of behavioral problems or some cognitive or learning difficulties, developmental milestones that may be late or missed, then that would be the reason, in my opinion, to seek out the care of the.
Yes, I would 100% agree with that. I think the other thing to remember is that HD in people who are very young is extremely different from people who are older. And so the signs and symptoms can be different. And so having a good pediatrician, keeping an eye on things, doing their regular exams is important. There is a great researcher out in she's doing work in young people who have a young history, trying to figure out symptoms. But I also agree that just having someone under a microscope can create a lot of anxiety and stress on its own. And so it becomes something that you need to be avoided.
A follow-up to this is the child is experiencing some of those behaviors and school things, and the child is 7, and so they are wondering if it would be a good time to start assessments.
I think it's hard to answer very specific questions about family care for specific people about this. I think in general, if there's a concern about it, making an appointment with a pediatrician and seeing if they should get a referral to a neurologist would probably be a good first step.
I agree, also at schools, they have most likely a plan in place for individuals who need a separate learning plan created to make them successful at school. So those sorts of efforts would not be necessarily different from one child with a particular, or from an individual who may have early signs of juvenile HD. So some things are specific evaluations for HD, and then other ones are not as tailored to HD necessarily, but good support structures to seek out in the community and then of course in schools.
I think I would also just be hesitant not to rush into genetic testing for a 7-year-old if they have some non-specific symptoms. I think it can certainly be discussed if after seeing a neurologist that there is a very high suspicion for juvenile Huntington's disease. But of course, there are guidelines that we don't recommend genetic testing before the age of 18 for a lot of good reasons. This is to prevent any discriminatory issues. The child being treated differently as they're going through school. And also just to remain autonomy of that child to make that decision if they want to know this is something that this for us. So I guess the other thing I would just discuss that I hope this child is also a part of the discussion and aware of this risk so that this information isn't just dropped on them when they're maybe adolescent, but just kind of a continuing age-appropriate conversations with this child about their genetic risk, given the family history, so that by the time they're 18, they feel, they've been about this for a long time, and they do have that choice to make to get predictive testing or confirmatory testing at that time. So I think just encouraging conversations and trying to include the child as much as possible as well.